Hello and welcome. Today we're diving deep into the world of aortitis, a heart condition you might not have heard of, but one with significant implications for cardiovascular health. We'll explore what aortitis is, what causes it, how it affects your body, and what can be done about it. Join us as we unravel the complexities of this inflammatory condition. So, what causes this inflammatory storm in the aorta? Aortitis is rarely a disease on its own. More often, it's a manifestation of another underlying condition. We can broadly categorize the causes into infectious and non-infectious. Infectious causes include bacterial infections like syphilis, tuberculosis, or even salmonella. Non-infectious causes are typically autoimmune disorders such as Takayasu arteritis, giant cell arteritis, relapsing polychondritis, ankylosing spondylitis, and rheumatoid arthritis. In some cases, the exact cause remains unknown, termed idiopathic aortitis. Now, let's delve into the pathophysiology, or how aortitis actually damages the aorta. The primary problem is inflammation within the wall of the aorta. This inflammation damages the aortic wall, making it weaker and more prone to complications. This inflammation can lead to several problems. First, it can cause the aorta to dilate or widen, forming an aneurysm. An aneurysm is like a ballooning out of the aorta, and if it gets too big, it can rupture, which is life-threatening. Second, the inflammation can cause the aorta to narrow, a condition called stenosis. Stenosis restricts blood flow, leading to reduced blood supply to vital organs. Finally, inflammation can cause the formation of blood clots in the aorta, which can travel to other parts of the body and cause strokes or other serious complications. Aortitis is a relatively rare condition. Its exact prevalence is difficult to determine, as it often goes undiagnosed or is misdiagnosed as other cardiovascular problems. Takayasu arteritis is more common in younger women, typically between the ages of 20 and 40. And is seen more frequently in Asian countries. Giant cell arteritis, on the other hand, is more common in older adults, particularly those over the age of 50, and is more prevalent in Caucasian populations. The occurrence of aortitis related to other autoimmune diseases follows the epidemiological patterns of those primary conditions. Generally, aortitis is more prevalent in areas where the underlying infectious or autoimmune conditions are more common. The signs and symptoms of aortitis can vary widely depending on the location and extent of inflammation in the aorta, as well as the underlying cause. Many people with aortitis experience general symptoms such as fatigue, fever, weight loss, and night sweats. Specific symptoms related to the aorta can include chest pain, abdominal pain, back pain, and shortness of breath. If the inflammation causes narrowing of the aorta, patients may experience high blood pressure in the arms and low blood pressure in the legs, a condition called claudication. Neurological symptoms such as dizziness, vision changes, and headaches can also occur if the inflammation affects blood flow to the brain. Aortic regurgitation, where the aortic valve doesn't close properly, can lead to heart failure symptoms like swelling in the legs and ankles. Diagnosing aortitis can be challenging as the symptoms are often vague and can mimic other conditions. Diagnosis typically involves a combination of physical examination, blood tests, and imaging studies. Blood tests can reveal signs of inflammation, such as elevated erythrocyte sedimentation rate (ESR) or C-reactive protein (CRP). Imaging studies are crucial for visualizing the aorta and identifying any signs of inflammation, thickening, or narrowing. Computed tomography angiographies (CTA), magnetic resonance angiographies (MRA), and positron emission tomography (EP) scans are commonly used for this purpose. A biopsy of the aorta may be performed in some cases to confirm the diagnosis and identify the specific type of inflammation. Aortitis isn't typically classified in a formal way, like stages of cancer, but it's helpful to think about it in terms of the underlying cause. So, we can distinguish between infectious aortitis and non-infectious aortitis. We also differentiate based on the location of inflammation. For example, thoracic aortitis affecting the aorta in the chest or abdominal aortitis affecting the aorta in the abdomen. And the type of aortitis depends on the associated underlying autoimmune disease. For example, Takayasu arteritis, giant cell arteritis, and so on. The treatment of aortitis focuses on reducing inflammation, preventing complications, and addressing the underlying cause. Medications are the cornerstone of treatment. Corticosteroids, such as prednisone, are commonly used to suppress the immune system and reduce inflammation. Immunosuppressant drugs, such as methotrexate, azathioprine, or cyclophosphamide, may be used in conjunction with corticosteroids or alone in cases where corticosteroids are not effective. If the aortitis is caused by an infection, antibiotics or antifungal medications will be prescribed to treat the infection. In cases where the aorta has become narrowed or an aneurysm has formed, surgical intervention may be necessary. This could involve angioplasty with stenting to open up a narrowed aorta, or surgical repair or replacement of an aneurysm. While it's not always possible to prevent aortitis, especially when it's linked to autoimmune diseases, there are steps you can take to reduce your risk. Preventing infections that can lead to aortitis, such as syphilis or tuberculosis, is crucial. Practicing safe sex, getting vaccinated against infectious diseases, and seeking prompt treatment for any infections can help. Managing underlying autoimmune diseases effectively can also reduce the risk of aortitis. This involves working closely with a rheumatologist and adhering to prescribed medications and lifestyle recommendations. Regular check-ups with your doctor can help detect aortitis early, allowing for prompt treatment and preventing complications. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, is always beneficial for overall cardiovascular health. The prognosis for aortitis varies depending on the underlying cause, the extent of aortic damage, and the timeliness of diagnosis and treatment. With prompt and effective treatment, many people with aortitis can achieve remission and lead relatively normal lives. However, aortitis can be a chronic condition, and relapses are common. Long-term monitoring is essential to detect and manage any complications, such as aneurysms, stenosis, or aortic regurgitation. Recent research has focused on developing more targeted therapies for aortitis, such as biologic agents that specifically target inflammatory pathways. These therapies have shown promise in reducing inflammation and preventing aortic damage. Researchers are also exploring new imaging techniques to improve early detection and monitoring of aortitis. Thank you for joining us on this journey to understand aortitis. We hope this information has been helpful and informative. Remember to consult with your healthcare provider for any medical concerns.